Hi everyone, my name is Jordan Churro, and I'm an assistant professor of medicine at the Winship Cancer Institute at Emory University, as well as a metastatic HSPC section editor for GU Oncology now. I'm here today to talk about the 2025 GU Symposium, which is actually right around the corner, and it's shaping up to be a very exciting event. Going through the ASCO abstract titles, one general topic I feel that I'm very interested in this year is biomarker-driven research. I'm truly looking forward to seeing how biomarkers can assist us in fine-tuning our treatments to our patients and maybe helping with, prognosis. And unfortunately, there are way too many abstracts to list in my short talk today, but definitely keep an eye out for updates on the latest in biomarker research. So I put together a list of abstracts that have caught my eye, and by no means this is all an inclusive list, but these are some of the key topics I'm really looking forward to. So let's kick things off with prostate cancer first. So the first abstract I've included is a final overall survival with atezolizumab and enza as first-line therapy in metastatic CRPC in the phase 3 TALAPRO-2 trial. This trial has been presented in the past, and we know that PARP enzymes regulate AR activity. So therefore, by inhibiting PARP, AR signaling is thought to be suppressed, making the cells therefore more sensitive to ADT. And this is important since HRR mutations are present in up to 25% of patients with metastatic CRPC. And we do have current data from TALAPRO-2 trial that did show an improved radiographic PFS in the overall patient population of not being reached compared to 21.9 months in the enzalutamide monotherapy arm. And of course, no surprise here, most pronounced benefits were seen in HRR deficient tumors, particularly BRCA1 and 2. So why is this important? Why am I excited? Well, I hope to see overall survival data in not only HRR proficient tumors, but also deficient tumors, meaning that if there is benefit, it does raise the question of if this trial solidifies combination therapy as a standard of care for all. And I'm also interested in the long-term adverse events because as we do know, there are toxicities to PARP inhibitors, especially long-term. So it'll be important to see how our patients tolerate this therapy. The second abstract in prostate cancer is a stop-cap meta-analysis, which is trying to answer the question of which patients benefit most from ARPIs. And what we know now is that the stop-cap analyzes data from multiple trials with the aim of determining the best treatment options for our patients. And this is important since we know that although manageable toxicity profiles, ARPIs can affect our quality of life in our patients. And what I'm hoping is that stopgap will provide guidance on how to tailor our therapy for our patients with metastatic HSPC. But perhaps, there will be data showing difference in outcomes compared to triplet compared to doublet therapy. And I do wonder if it will hint to perhaps the best sequencing of therapy. So a lot of questions with this abstract title, but I'm excited to see, what questions it answers. So now let's switch gears to kidney cancer. The first trial I'm highlighting here is the final results of Cosmic 313, which was a study comparing cabozantinib with nivo and ipi in previously untreated RCC. And there has been earlier analysis of this study, which has shown that adding cabo did improve median PFS, which was not reached in the combination arm, compared to 11.3 months in the doublet arm. Also, interestingly, the objective response rate was 43% in the triplet arm compared to 36% in the doublet. And interestingly, that the PFS was actually more pronounced in the intermediate IMDC risk group and no apparent benefit in the poor risk group. So why is this important? So I feel that the results that will be presented in regards to overall survival will be very important as this could change our landscape for patients with in the frontline setting for RCC. And also, would this be a tailored therapy for only intermediate risk IMDC patients, or will we be surprised to see perhaps more outcomes in other risk groups? Looking at the next title, the ASCO title for RCC, I do have here, and this is a particular interest of mine, is actually healthcare disparities. Specifically, this renal cell carcinoma abstract was from the French Kidney Cancer Research Network, which plans to look at disparities in RCC and outcomes. And what we know now is that RCC histology subtypes actually do vary between racial groups. And unfortunately, we do have data showing that African Americans tend to have poor survival rates compared to Caucasians. So I'm hoping that this study will highlight the differences in racial groups, show us if there's differences in survival, And I'm also hoping that perhaps it will identify factors that might lead to different outcomes so we can do better for all our patients, as well as understand perhaps disease biology. So now let's spend some time on bladder cancer, which has been a very exciting field in GU oncology last year, particularly with the approval of enfortumab vedotin and pembrolizumab. And looking here, the first trial I've decided to include is the updated analysis of EV302. And what we know is that the combination of EV and Pembro was actually the first treatment to surpass platinum-based chemotherapy in metastatic urothelial carcinoma. And this was huge and very exciting update for GU oncologists like myself. And the trial in particular showed that median overall survival improved from 16.1 months to 31.5 months, as well as response rates from 44 to 68%. But the most exciting part for me, at least, was that the complete response rates in metastatic, so stage 4 bladder cancer, were as high as 30%. So fantastic results and a very exciting time for patients with bladder cancer. So I think that, it's obvious why I'm looking forward to this discussion. I'd love to see a durability of enfortumab vedotin with Pembro, but also I'd like to understand long-term safety profile, as well as if we do have perhaps a detailed subgroup patient analysis to understand who benefits the most from this treatment. The second bladder-specific abstract I've included is actually, and I'm looking forward to, is exploring neoadjuvant therapy with disitamab vedotin plus perioperative toripalimab in patients with muscle-invasive bladder cancer with HER2 expression. And reviewing and educating myself in this data, what we know now is that disitamab is a HER2-targeted androgen ADC, and toripalimab is a PD-1 inhibitor. And we do have preliminary data showing that patients receiving this combination therapy do have a pass-CR rates at time of cystectomy of actually up to 62%, as well as a pathologic response rate in 75%. Looking at these numbers, this is a very small initial study, but I am excited to hear more because one, it might be a promising new therapeutic approach to bladder cancer. And also, if it does show impressive efficacy and a safe toxicity profile, it really does make me wonder if a portion of patients might actually be cured. I mean, it could potentially forgo surgery and preserve their bladder in the future. And knowing that, it would be important using biomarkers to help identify, maybe using circulating tumor DNA, who perhaps might be cured and could they forgo surgery with still great outcomes. So a very cool study, something I had to do a little refresher myself on regarding these agents. And then before I wrap up, I definitely can't go on without mentioning antibody-drug conjugates. I've definitely, already spoke about enfortumab vedotin and dasatinib in the last two abstracts, but I've decided to include a list of ADCs, their targets, and payloads that will be presented. And specifically, for those listening, antibody-drug conjugates are especially exciting because they offer a highly targeted approach to delivering chemotherapy and directed specifically to cancer cells in the hopes to minimize off-target toxicity. So very, very exciting stuff. So with that being said, it's clear that ASCO GU is a must-attend conference and with very exciting updates, and I can't wait to hear what everyone thinks. So thank you for listening, and until next time.